I'm Dr. Richard Hayek. I'm a board-certified orthopedic surgeon. I've been practicing for about 3 decades and enjoyed every minute of it. One of the procedures that I have special expertise in is the direct anterior total hip replacement. That's the front approach to the hip. For the right patient, the direct anterior, the anterior approach, seems to have a speedier recovery, and that's not just my perspective, it's my own patient's perspective. My practice philosophy is to optimize non-operative treatment. Many times patients come to me and they don't really know what the diagnosis is. We'll outline a very solid diagnosis, and then we'll do non-operative treatment before surgical care. The most important part is a shared decision-making. We prioritize what they prioritize, and I think that's an important conversation and dialogue going back and forth. I think artificial intelligence can't substitute for that connection between the patient and physician, and they have to have a good working relationship to work toward mutual goals. I'm really blessed to be an orthopedic surgeon. I can't imagine practicing a different specialty.